Hello and welcome to the Henna Hundal Show. I'm your host, Henna Hundal, and the Henna Hundal Show is brought to you from the studios of Harvard Radio Broadcasting. Here on the Henna Hundal Show, we feature the world's foremost experts for groundbreaking discussion within their respective fields, spanning medicine, science, technology, business, politics, policy, law, and more. Join me, your host, Henna Hundal, on a mission to unpack and understand how contemporary high-impact issues are being tackled by the world's most influential leaders. For today's episode, I'm honored to share the air with our esteemed guest, Dr. Anne Schuchat. Dr. Schuchat is the current Principal Deputy Director of the Centers for Disease Control and Prevention, a role she has been serving in since 2015. Between January and March of 2018, Dr. Schuchat served as the acting director of the Centers for Disease Control and Prevention. The Centers for Disease Control and Prevention, or CDC for short, is the country's premier national public health institute. The CDC puts forth an array of initiatives to ensure public health in the ways of, for example, injury prevention, occupational health and safety, or preventing the spread of infectious diseases. Towards the latter point, the CDC is often tasked with putting forth coordinated responses to contain the spread of infectious diseases in a quick, efficient, and effective manner. Take, for example, the 2009 H1N1 swine flu outbreak, or the 2014 Ebola outbreak. The CDC played critical roles during each episode in working to reestablish public safety, health and well-being, and continue its protectionary functions through ongoing programs. Not to mention, the CDC offers some of the most reputable data and statistical information on public health topics. And I really encourage anyone curious in learning anything about topics ranging from diabetes to alcohol use, to oral health, to reproductive health, and everything in between, to visit the CDC website because really it's a great resource. I'm incredibly honored to share a conversation with Dr. Anne Schuchat today because she's been one of the key figures at the CDC helping to ensure public health during such critical times as the 2001 anthrax attacks and the severe acute respiratory syndrome, or SARS, outbreak, and the 2009 flu pandemic, just to name a couple of examples. Her crucial work during these times of crises has earned her the informal nickname of, quote, a real-life virus hunter, according to a profile of Dr. Schuchat by the CDC Foundation, underscoring her critical work in preventing the spread of infectious diseases and launching effective emergency response measures when outbreaks have occurred. Dr. Schuchat has been routinely acclaimed and awarded for her work. Unfortunately, there can be a lot of misunderstanding in the general public about the spread of infectious diseases. For example, what is the difference between seasonal flu and pandemics like the 2009 H1N1 swine flu pandemic? Moreover, where do we currently stand in the development of effective vaccines against Ebola? What progress has been made in that regard? Well, these are tricky questions, and I'm beyond thrilled to have Dr. Schuchat with us to provide some answers on these questions and more. Please join me now in welcoming Dr. Schuchat to the program. So, Dr. Schuchat, you've done so much work over the course of your career at the CDC in campaigns against flu. And I think one of the prime examples of your commitment and know-how on this topic is the incredible emergency response work you spearheaded during the 2009 swine flu or H1N1 pandemic. And in your role at the CDC, I'm curious, what features differentiate your concerted responses to seasonal flu or regular flu that presents in a similar fashion annually versus flu viruses like H1N1 that crop up in not such a regular expected fashion? You know, in general, how do you think about combating these two categories of viruses differently?
Our work on seasonal influenza strengthens our preparedness for pandemics, and our response to pandemics feeds into the work we do on seasonal flu. So they are closely related. But of course, a pandemic is an extreme example of what the influenza virus can do. It occurs when a new virus that people are completely susceptible to comes into a population and is able to cause disease and efficiently spread person to person. We work on the avian influenza or bird flu because it can be quite dangerous to people, and we don't know whether there'll be mutations or changes that make it more efficiently spread person to person. But every year, seasonal flu gives us this chance to prepare, immunize, get the healthcare system ready to respond, and make sure that healthcare professionals can treat patients who come in with severe presentations or who are at risk for severe complications. While a pandemic like the 1918 one can cause more than 50 million people around the world to die, last year 80,000 Americans died from seasonal flu. So it's a serious issue and one we work really hard at.
Right. And recently, the Pregnancy Research Ethics for Vaccines, Epidemics, and New Technologies Working Group released a report highlighting how largely excluded and overlooked pregnant women are in research studies on new vaccines. And relatedly, I'm curious to hear your take on that, and if A, we need to find ways to bring this demographic into the fold of vaccine research more, and B, how we could potentially go about doing that in a more effective way.
It's an incredibly important topic, and I'm really glad you raised it. One of the most tragic parts of dealing with the 2009 H1N1 pandemic was the early deaths that we saw among pregnant women. We're not used to thinking about infections as lethal in healthy pregnant women. We saw that with the pandemic, and we see it, unfortunately, sometimes with seasonal flu as well. And again, with the vaccine studies, they've typically excluded pregnant women, even though they have increased vulnerability against a variety of threats. So there's work at play right now to make sure that research does include pregnant women and that the risks are the highest among pregnant women get addressed more carefully. We recommend that pregnant women get a flu vaccine every pregnancy. We recommend that pregnant women get a Tdap vaccine, which can protect against whooping cough every pregnancy. And we saw with the severe illness in the 2009 pandemic, that obstetricians and women started to increase the use of vaccines during pregnancy. We don't have as high coverage as we'd like to have, but we're doing better than we did before 2009.
Yeah, and in addition to that, I know you've also been involved in work on Ebola vaccine trials in West Africa, particularly after the gravity of the Ebola epidemic of 2014 to 2016. And from my understanding, in December 2016, it was reported that the VSV-EBOV vaccine offered around 95% protection against the virus. And I'm just wondering if you can give us updates on where we currently stand with the development of vaccines against Ebola that are widely accepted as effective.
2014-15 Ebola epidemic was extraordinary in its impact, and another extraordinary aspect was that researchers, including CDC, studied investigational vaccines in the midst of the epidemic. CDC worked with colleagues in Sierra Leone and tested the VSV vaccine in about 8,000 healthcare workers and other frontline workers. They were really hard hit by Ebola, and the vaccine proved to be very safe in that population. A study in Guinea showed that it was highly effective, and because of that, the recent epidemic of Ebola in the Democratic Republic of Congo has incorporated vaccination in a ring strategy around cases, as well as for healthcare providers, as part of the control effort. About 50,000 people in the Democratic Republic of Congo in this recent outbreak in the eastern and northeastern part of the country have gotten vaccinated. We think that that vaccination has helped limit the disease. It's still a very serious outbreak. It's the second largest outbreak ever, but without vaccination, it would have been much, much worse. So we are working hard with colleagues in the region, with the World Health Organization and other partners to try to end this epidemic, but the vaccine is playing a key role. The vaccine that's being used, the VSV vaccine, isn't yet licensed, so it's being used under an emergency use authorities, but it is being submitted for licensure, and we hope in the future we'll get that vaccine to be much more accessible.
Right. And, relatedly on this topic of vaccines, in a report released by the CDC in 1999, I believe, vaccination was cited as one of the 10 great public health achievements of the 20th century. And given that flu fighting, or fighting flu by encouraging vaccination, is a huge component of your work, I'm curious to know how you begin to respond to the anti-vaccination movement. It's a movement that I understand has roots that go way back, and it's not a new uprising, but what is the best response to the pushback, do you think, from that community? Do we intellectually engage them and try to persuade with scientific evidence, or do you think we should turn to legal measures and try to enforce vaccination through the legal arm?
It's a really complex area. I start from the premise that every parent is trying to protect their children and keep them healthy and safe. Mm-hmm. And the better information they have and the more trust they have in their clinicians or those around them, the better decisions they'll make. The approach the CDC has been taking has been to pull together the best scientific information and the stories of what happens when you don't vaccinate and when you unfortunately do delay or develop a disease that could have been prevented, and provide that information through trusted channels, primarily doctors, nurses, and other healthcare professionals, so that they can have good conversations with families. There are probably some groups that will never be convinced about the value or safety of the vaccines that we have, and there's others that don't have any questions at all. But for a lot of people who are just wondering about all these different stories they're hearing or the things that they've read about or heard about, getting them correct information from trusted people is probably the best way to go. They may not listen to a celebrity or to a political figure or to somebody at the CDC, but your doctor or nurse who knows you and your family can talk to you about what you're concerned about and what the science shows.
And that was an interview with Dr. Ann Schuchat, shedding light on her work at the Centers for Disease Control and Prevention and offering her expertise on some really complex issues regarding the spread of infectious diseases. I'm incredibly grateful again to Dr. Schuchat for taking the time to join me for that conversation. I found it particularly fascinating to learn about some of the research progress in our understanding of Ebola and how in general we can improve vaccine research by ensuring a diversity of the demographics that are included in the studies. So in light of that, I really valued today's conversation, and I hope you enjoyed it too. You have been listening to The Henna Hundal Show, brought to you from the studios of Harvard Radio Broadcasting. I'm your host, Henna Hundal, and I thank you for tuning in. We'll catch you next week.